This is Dr. Corey Maas on Looking Your Best. Implantable materials have been used for many centuries in humans, and there have been a whole series of them tried. In today's world, we're using a lot of injectable soft tissue fillers. You've heard me talk about them. They're very exciting products, things that we can do in a very small procedure in the office and have really outstanding outcomes to address small or larger contour defects in the face and other areas of the body. What's interesting is that solid implants, which I've used for more than 20 years now, are still excellent options, and in fact, in many cases, much better options than these injectable fillers because they offer a long-term solution for patients. The most common areas for doing this are the chin, when the chin is weak or recessed back behind the lower lip, and your lip in profile view should pretty much meet your chin if you were to look at profile view. That gives you a perfect profile. In some patients, you don't need a perfect profile, but if your chin is really weak or you have a dip yet here at the corner where what we call the labiomandibular sulcus, the big deep dip in front of the jowl, the prejowl sulcus, those are great patients to do chin implants and get a long-term correction. These procedures can be done as outpatients with local anesthesia or local with a little sedation or light sleeping anesthesia. There's a couple of different approaches. We can go through the inside of the mouth and have no scar. If we're going to do a little lipo under the chin, we can make a small incision underneath the chin. Neither of them are visible, tiny little scars that are practically invisible under the chin, and no scar if you go through the mouth. The other area that's commonly implanted in a long-term way, which in today's world again is being supplanted by the use of these soft tissue fillers, the injectable fillers, are malar implants. And malar implants have a variety of different sizes and shapes that can be used. I go underneath the lip with this. I create a perfect pocket size. It can be designed to augment the mid-face, the lateral cheek area, or the malar enhancement if you want a higher cheekbone, or depressions in or along the orbital rim, the lower part of the eyelid. All those are very good targets for using an implantable material. They're now made of silastic. They're not hollow or filled with any kind of liquid, so they're not going to leak or break down over time. In fact, in cadaver dissections I've done in teaching students and fellows and residents, we've taken these implants out of 80, 90, 100-year-old now cadaveric former patients and found those implants to be perfect while the tissues have deteriorated with age. The beauty is that they're totally removable and that they're adjustable. If we needed to have some small adjustment, we can go back and do those. That's pretty rare. In my practice, the adjustment or removal rate is less than 1% over 20 years, as is the infection rate, which is reported in the literature to be about 3%, 3 or 4%, depending on the study you're looking at. So as a long-term solution for correction of weak chin, what we call a microgenia, small chin area, or loss of definition along the chin, augmenting a chin if there's a little more shape needed, for giving volume to the mid-face, that's a long-term correction as an alternative to fat injections or some of the soft tissue fillers. Solid implantable materials offer an excellent option that has low risks, low complications in the right hands, and is something that patients can rely on for the long term. If you have any questions about injectable filler materials, or more specifically our discussion point today, these implantable materials, please don't hesitate to contact me, drmaas.com. You can send photographs if you want, and I can morph those images with computer imaging and show you either privately or publicly if you wish to share those images before and after. And certainly visit my website at maasclinic.com, where we have more written information about facial implants. This is Dr. Corey Maas on Looking Your Best.